Welcome to the Saul's Newsstand News Review for May 8th, 2020. An article from the Federalist states, Joe Biden's Medicare at 60 plan shows Democrats' lust for socialized medicine. The day after Socialist Senator Bernie Sanders suspended his campaign for the Democratic presidential nomination, presumptive nominee and former Vice President Joe Biden announced his support for a smaller version of Sanders' signature single-payer proposal. Biden said he had directed his team to develop a plan to lower the Medicare eligibility age to 60. As with many Democratic plans, the proposal sounds like a moderate option. After all, near seniors will join Medicare soon enough, so how much harm could this plan cause? Apart from serving as obvious political sop to the Sanders crowd, the Biden Medicare at 60 proposal would function as a major cost shift. By and large, it wouldn't help the previously uninsured option coverage nearly as much as it would use federal dollars to supplant funds already spent by the private sector, whether by individuals or their employers. By doing so, it would build the culture of dependence that represents the left's ultimate aim, crowding out private insurance and private spending and putting more people on the government rolls. That Biden would propose a plan so obviously centered around that objective shows he doesn't fundamentally disagree with Sanders' single-payer plan at all. He just doesn't want to disclose his intentions before bringing socialized medicine to the American healthcare system. An article from The Hill reports, White House sticks with Republican attorneys general fighting to overturn Obamacare. President Trump said Wednesday his administration is sticking with Republican state attorneys general who are suing to overturn the Affordable Care Act, or ACA, after reports indicated U.S. Attorney General William Barr wanted to modify the Justice Department's stance on the lawsuit. The administration's position on the lawsuit has changed several times since it was filed in 2018. The Justice Department said last year the entire law should be struck down after initially saying some protections should be preserved. Because the Trump administration declined to defend the law against legal challenges in a break from standard protocol, Democrat attorneys general led by California have mounted the defense of the ACA. The Supreme Court in March agreed to hear the case after the Democrats challenged a federal appeals court ruling that the mandate was unconstitutional. The appeals court punted the case back down to a lower court, which ruled in 2018 that the law is unconstitutional because it can't stand without the mandate penalty. And finally, the Washington Examiner reports, experts predict half of U.S. coronavirus deaths will happen in nursing homes. The state of New York this week released data showing an additional 1,600 deaths at nursing homes due to the coronavirus that were previously undisclosed. As of Sunday, 4,813 people have died of the virus at nursing homes in the state, accounting for under a quarter of all fatalities from COVID-19 in New York so far. The federal government has no system tracking nursing home cases and fatalities, but some especially hard-hit states have been slowly releasing data on nursing home deaths since the outbreak began. In Connecticut, for example, nearly 90% of all deaths from COVID-19 were in nursing homes between April 22nd and April 29th. State health officials say about 60% of all coronavirus deaths in Connecticut have been in nursing homes. In neighboring Rhode Island, that total is nearly 70%. In New Jersey, the percentage sits at more than half. Nursing home deaths in Massachusetts account for nearly 60% of that state's total. And that concludes your Saul's Newsstand News Review for May 8th, 2020. For more political news faster, visit saulsnews.com.